Greetings, everyone, and thank you for joining the U.S. Department of Health and Human Services Office of Minority Health's Technical Assistance webinar for the community-driven approaches to address factors contributing to structural racism and public health. My name is Sincere Cobb-Souza, and I'm the Director of the Division of Program Operations within the Office of Minority Health. I am joined today with my colleagues, Lieutenant Commander Lucy Martin Braswell and Mr. Dwayne Barlow, Branch Chief in the Office of Grants, Acquisition, and Management with the Office of the Assistant Secretary for Health in the department. The presentation slides from today's webinar, along with a list of frequently asked questions or FAQs, will be posted to grants.gov. To access the presentation slides in the FAQ document, you will need to visit the grants.gov website and access the Notice of Funding Opportunity Announcement page. To get there, you will search in the grants.gov search browser for the phrase community-driven approaches to address factors contributing to structural racism, or the Notice of Funding Opportunity, or the NOFO number. The first result will take you to the NOFO's page. You will navigate to the Related Documents tab for the presentation slides and the FAQ document. Please note, we have reviewed all questions that were sent prior to today's call. Many of your questions will be answered throughout the presentation. To ensure fairness, questions received via email and the chat box from today's webinar will be answered in the frequently asked questions document that will be posted to the grants.gov website. At this time, I will turn it over to our first presenter, Lieutenant Commander Martin Braswell.
Thank you. Please go to slide 2. Today's webinar agenda includes an overview of the community-driven approaches to address factors contributing to structural racism in public health. From here on, I will be referring to the NOFO as community-driven approaches for short. The competitive application requirements will be covered by the Office of Grants and Acquisition Management, and we will conclude the call with a question and answer session. Before we move forward, all webinar participants have been muted, and please use the chat box as noted to communicate questions you may have for inclusion in the frequently asked documents. Please go to slide 3. The Notice of Funding Opportunity provides information and guidance related to the application. We encourage you to read the entire funding announcement and follow the NOFO carefully as you prepare your application. Lastly, the information provided in the NOFO takes precedence over any conflicting information in any other document. Please go to slide 4. On pages 1 and 2 of the NOFO, you will find the executive summary. The Community-Driven Approaches NOFO solicits applications for projects to support development and implementation of new policies and innovative practices to address policies that may create or perpetuate health disparities and may contribute to structural racism. OMH expects recipients to address health disparities among racial and ethnic minority populations and to demonstrate the impact of those efforts on outcomes and the overarching goal of advancing health equity. Please go to slide 5. For those of you who are not familiar with the HHS Office of Minority Health, the Office of Minority Health is dedicated to improving the health of racial and ethnic minority populations through the development of health policies and programs that will eliminate health disparities. Through its demonstration projects, OMH supports the identification of effective approaches for improving health outcomes and the goal of promoting dissemination and sustainability of those approaches. Please go to slide 6. For those of you who may have joined late, we would like to say again that the PowerPoint presentation accompanying today's call will be posted to grants.gov. In this portion of the presentation, I will discuss the approaches to the development and implementation of new policies and innovative practices to address policies that may create or perpetuate health disparities and may contribute to structural racism as described in the NOFO. I will begin with some background information and explain how the NOFO seeks to address public health system challenges through the program approach. Historically, racial and ethnic minority population experience health disparities and poor health outcomes across many health conditions. These health inequities are due in part of circumstances such as poverty, structural racism, and discrimination. To address racial and ethnic disparities effectively, including potential contributors to structural racism, evidence suggests developing and/or strengthening community-focused solutions. An emphasis on building capacity of multi-sector teams as a critical resource for addressing the diverse range of policy areas and practices that may create or perpetuate health disparities and may contribute to structural racism. Please go to slide 7. The community-driven approaches will build upon the OMH-funded FY 2021 framework to address health disparities through collaborative policy efforts initiative, in which the National Network of Public Health Institute was awarded the cooperative agreement and serves as the coordinating center. The coordinating center is expected to lead the development and evaluation of a methodological framework, structured process, and tools to support the assessment and identification of policies that may create or perpetuate health disparities and contribute to structural racism. Recipients under the community-driven approaches NOFO covered today will utilize the policy assessment framework from the coordinating center. Recipients will demonstrate the effectiveness of this tool to increase the capacity of community-led teams to identify policy impacts that may create or perpetuate health disparities by contributing to structural racism. Please go to slide 8. On this slide, we will review the policy assessment and analysis framework under development by the Coordinating Center or the National Network of Public Health Institutes, which is based on legal epidemiology. There are 3 phases of the legal epidemiology process. Phase 1 is planning, phase 2, operationalizing, and phase 3, analyzing. I will briefly review each of these 3 phases of the policy assessment and analysis framework. We encourage all applicants to review the 3 phases of the legal epidemiology policy assessment and analysis framework provided on pages 63 through 67 of the NOFO. Phase 1 is identified as the planning phase and includes a review of the evidence, draft research questions, identify laws and legal mechanisms, developing a logic model, checking the data sources, and selecting a research design. Phase 2 of the policy assessment and analysis framework is noted as operationalizing. In the operationalizing phase, recipients will identify or build legal and outcome data, code the laws and policies, identify an analytical plan, select variables, and merge data for analysis. And finally, in the analyzing phase, recipients will run descriptive analysis, bivariate explanatory analysis, predictive causal analysis accordingly. Interpret those results, discuss the results, and translate those into practice. Please go to slide 9. In this section, we will highlight important information to ensure all applicants understand the expectations of this NOFO. OMH recipients should aim to meet the following 8 components in the execution of their funded project. The expectations of this NOFO can be found on pages 8 through 11 of the NOFO. Please note this NOFO does not involve or permit lobbying. I will now review each of the 8 OMH expectations for the community-driven approaches. NOFO, please go to slide 10. The first component of the OMH expectation is to assess policies and practices found on pages 8 through 9 of the NOFO. OMH recipients should incorporate into their project the framework and tools under development by the Coordinating Center, coordinate and collaborate with the Coordinating Center to provide feedback and data on the effectiveness of the framework and tools used in their respective projects, develop and implement a plan that it seeks to improve or modify policies and practices that perpetuate health disparities and may contribute to structural racism. Please go to slide 11. The policy and practice assessment should include an identification of policies and practices that may create or perpetuate health disparities and contribute to structural racism, impact of the identified policies and practices on health outcomes, policy-making or decision-making process for modifying that existing policy, and the feasibility of implementing policy and practice change for each local level and practice. Please go to slide 12. The second component of the OMH expectation is to develop, modify, and implement policy and practice found on page 9 of the NOFO. OMH recipients should lead the multi-sector team in designing and building support for the implementation of the new or the modified policies and practices, as well as develop innovative practices to reduce health disparities and improve access to public health services based on the policy and practice assessment. In addition, recipients through the multi-sector team should develop action plans for modifying existing policies and practices, as well as implement those plans to the extent possible to reduce or remove structural racism and improve health outcomes. Please go to slide 13. The third component of the OMH expectation is to build a multi-sector team, which can be found on page 9 of the NOFO. Recipients should create a new and/or strengthen an existing multi-sector team focused on addressing factors that may contribute to structural racism. The multi-sector team should include members who represent communities experiencing health disparities as a result of structural racism. Please go to slide 14. The fourth component of the OMH expectation is to advise, assist, and train community stakeholders as outlined on page 9 of the NOFO. Recipients should build and strengthen a multi-sector team focused on addressing structural racism in public health. Recipients will advise, assist, and train community stakeholders to empower public and nonprofit entities, including community-based organizations, to make equitable, data-driven policy and practice decisions, as well as effectively address structural barriers contributing to health disparities among racial and ethnic minority populations. Please go to slide 15. The fifth component of the OMH expectation is to develop and implement an evaluation plan, which is found on page 10 of the NOFO. Recipients should develop and implement a process and outcomes evaluation plan, which clearly assesses the extent to which the projects result in an increased capacity of community-focused multi-sector teams to assess policy and practice impact, increase the number of proposed practices to reduce health disparities by improving access to public health services, increase the capacity of community stakeholders to access, translate, synthesize, and utilize data, and improve health outcomes for racial and ethnic minority populations. Please go to slide 16. The sixth component of the OMH expectation is to disseminate findings found on page 10 of the NOFO. Recipients should communicate and disseminate project knowledge and findings to include dissemination to federal, state, territorial, and tribal public agencies, policymakers, community organizations, community members, and stakeholders. Please note all appropriate findings and products may be posted on the HHS Office of Minority Health sponsored website as determined by the Department of Health and Human Services and the Office of Minority Health. Please go to slide 17. The seventh component of the OMH expectation is to develop a sustainability plan, which can be found on page 10 of the NOFO. Recipients should develop a plan for sustaining the project within 1 year following the start of the project. The sustainability plan should include the identification of key individuals and/or organizations whose support will be required in order to sustain the activities. An identification of an approach for securing financial, as well as staff, supervisory, and material resources required to sustain and support continued efforts beyond the end of the project period. An identification of existing collaborative partnerships with organizations that might embed the project activities within their routine operations or provide other support for sustaining successful activities. Please go to slide 18. The final component of the OMH expectation is a disparity impact statement found on page 11 of the NOFO. Recipients should develop a disparity impact statement during the project period using local data to identify populations at highest risk for health disparities relative to this initiative. A disparity impact statement refers to the demographic, cultural, and linguistic data that identify the populations in which health disparities exist and the quality improvement plan designed to address the noted disparities. The disparity impact statement will provide the measurement framework for ongoing monitoring and determining the impact of the project activities on outcomes and overarching goal of advancing health equity. The U.S. Department of Health and Human Services have provided resources in the NOFO to assist applicants with developing the disparity impact statement. Please go to slide 19. OMH will have substantial programmatic involvement with the recipient during the period of performance in carrying out the activities as outlined in the project proposal, as including serving as a resource to programmatic support during the implementation of the project by participating in the design of the activities and contributing with subject matter expertise. Review of recipient process or progress against any approved work plan for awarded activities and approval to move forward with implementation at significant milestones, facilitating collaboration and communication with the OMH-funded coordinating center. Please go to slide 20. Involvement may also include identification of organizations the recipient should consider for potential collaborative relationships and partnerships, prior approval for change of time that key personnel are dedicated to the project, and for replacement of key personnel. Key personnel are those individuals who either because of their specialized expertise or because of the specific role they fulfill in the project are essential to the conduct of the project, including an evaluator, principal investigator, or project director. Involvement may also include participating in the preparation of publications and public presentations of the data obtained under this award, as well as assisting in the dissemination of any materials or products produced as part of the project. And finally, reviewing all communications or disseminated work product co-branded with the Department of Health and Human Service, Office of Minority Health, or any other Department of Health and Human Service component for prior approval of the communication method and its contents. Please go to slide 21. In this next section, we will highlight important information related to the application content, which can be found outlined on pages 17 through 30 of the NOFO. Successful applications will contact the following information. The project narrative is the most important part of the application since it will be used as the primary basis to determine whether your project meets the minimum requirements for an award under this announcement. The project narrative should provide a clear and concise description of your project. We will review the recommended components for the project narrative on the next slide. You must complete the required budget forms and submit a budget narrative with detailed justification as part of your application. The budget narrative consists of a detailed line item budget that includes calculations for all costs and activities by object class categories, identified on the SF424A form and justification of the costs. The Office of Grants and Acquisition Management Office will review the budget narrative in more detail later. We will review the appendices required for your application shortly. All items described in the appendices section will count towards the total page limit of your application. You must submit them as a single electronic file uploaded to the attachment section of your grants.gov application. Please go to slide 22. I'll spend a few minutes reviewing the following components of the project narrative, which can be found on pages 17 through 21 of the NOFO. Your project narrative should include these headers in your application accordingly. The statement of need, which describes the scope of the problem using available quantitative data that will be addressed by the proposed project, including the populations and geographic areas of focus and the disproportionate impact on racial and ethnic minority populations in that specific geographic area of focus. It should also describe the policies and practices to be addressed by the proposed project that exists in the target community that creates or perpetuates health disparity and may contribute to structural racism. The project plan should include 3 components. It should describe your project's proposed goals and major objectives. Your objectives should be specific, measurable, achievable, realistic, and time-bound. It should also clearly identify the measurable outcomes that will result from the project and provide specific quantified estimates of expected outcomes. Of note, a measurable outcome is an observable end result that describes how a particular intervention benefits project participants. It demonstrates the impact of the intervention. It should also describe, using available data, how your policy intervention will address structural racism and health disparities to promote health equity, including the projected impact of project activities on populations at risk for experiencing health disparities. Describe the approach you will use to strengthen, create, convene, and manage the multi-sector team. And you should also describe how the approach is culturally and linguistically appropriate for the population of focus. Your project plan should also provide a summary of activities supported by specific details in the work plan in your appendices and how they will assist in achieving the project goals and objectives during the entire project period. You may, but are not required to use the work plan template provided in the application materials. Organizational capability. Applicants should describe the organization's capability to successfully implement the proposed project, including implementation readiness and ability to demonstrate impact within the project period. You should also clearly identify key personnel for your project. Again, key personnel includes individuals who will oversee the technical, professional, managerial, and support functions and/or assume responsibility for assuring the validity and quality of your organization's program. Your evaluation plan. Evaluation and performance measurements will monitor the extent to which planned activities are completed successfully, show the effectiveness of policy interventions, and demonstrate achievement of program outcomes. The Office of Minority Health uses evaluation findings to ensure continuous program quality improvement, help create and disseminate evidence base for culturally and linguistically appropriate capacity building strategies, and assess which interventions and practices are scalable. The dissemination plan should describe the method that will be used to document and disseminate your project's results and findings in a timely manner. It should also describe your target audience and the general public, as well as other parties who might be interested in using the results from your project. And finally, the sustainability approach should describe your approach for developing the sustainability plan that provides a concrete set of action steps necessary for maintaining any successful intervention associated with the successful outcomes after the award. It should also describe how you will identify key individuals and/or organizations whose support will be required to sustain the activities. As a reminder, the Office of Grants and Acquisition Management will review the budget narrative content shortly. We encourage all applicants to refer to the NOFO for complete project narrative requirements. Please go to slide 23. In this section, we will highlight items to be included as appendices, which are covered on pages 28 through 30 of the NOFO. All items in this section will count towards the total page limit of your application. You must submit them as a single electronic file uploaded to the attachment section of grants.gov. You may use the optional objective work plan template provided in the application materials, or you may create your own work plan. Regardless of the option you choose, the work plan you submit must address all of the contents requested. Your work plan should reflect and be consistent with the project narrative and budget narrative and must cover all years of the period of performance. The project population of focus, you must submit a table outlining the populations of focus for the proposed project, disaggregated data by race and ethnicity within the identified geographic area of focus using quantitative data. If available at the time of submission, signed memorandum of agreements may be submitted for all entities that have been specifically named to carry out any aspect of the project, including the multi-sector team, or one signed memorandum of agreement with all partners included. The signed memorandum of agreement must clearly detail the specific roles, responsibilities, resources, including in-kind resources, that each entity will bring to the project. Letters of commitment should be submitted if a memorandum of agreement has not been fully executed at the time of submission. A letter of commitment signed from an anticipated subrecipient or partner must detail the specific role and resources that will be provided, or the activities that will be undertaken in support of the application. Fully executed memorandum of agreements will be required within 30 days following the issuance of any award made under this announcement. Letters of support are letters that are general in nature that speak to the writer's belief in the capability of an applicant to accomplish a goal or a task. Letters of support also may indicate an intent or an interest to work together in the future, but they lack specificity. You should not provide letters of support, and letters of support will not be considered during the review. Organizational chart should be included as part of your appendices that reflects the management structure for the project and demonstrates where the project resides within the greater organization. You must submit a logic model that specifies and describes the program theory to be employed in the intervention. And you must submit with your application curricula vitae or resumes of the project director, principal investigator, evaluator, and all other key personnel. Please go to slide 28. Before I turn the meeting over, again, if you joined late, you may have missed our instructions regarding today's presentation slides. The presentation slides from today's webinar and frequently asked questions will be posted to grants.gov. To access the presentation slides, you will use the search bar to input the title of this notice of funding opportunity or the notice of funding opportunity number. I will now turn the remainder of the webinar over to Mr. Dwayne Barlow, Branch Chief, HHS, Office of Grants and Acquisition Management.
Good afternoon, everyone. My name is Dwayne Barlow, and at this time, we'd like to discuss with you the application submission requirements. Next slide, please. Okay, submission dates and times. So your application is due by 6 p.m. Eastern Time on July 15th, 2022. Your submission time will be determined by the date and timestamp provided by grants.gov when you complete your submission. You're strongly encouraged to submit your application a minimum of 3 to 5 days prior to the application closing date. Grants.gov may take up to 48 hours to notify you of a successful submission. If you fail to submit your application by the due date and time, we will not review it and it will receive no further consideration. Next slide, please. Okay, as for eligible applicants, so those would be any public or private nonprofit entities located in a state, which includes one of the 50 United States, the District of Columbia, the Commonwealth of Puerto Rico, the U.S. Virgin Islands, Commonwealth of Northern Mariana Islands, American Samoa, Guam, the Republic of Palau, the Federated States of Micronesia, and the Republic of the Marshall Islands, is eligible to apply for an award under this announcement. Faith-based organizations and American Indian, Alaska Native, Native American organizations that are public or not-for-profit private entities are eligible to apply. Community-based organizations that are public or not-for-profit private entities are eligible to apply. Next slide, please. So we wanted to provide some examples of eligible applicants on this slide. So we're looking at state governments, county governments, city or township governments, special district governments, independent school district, public and state controlled institutions of higher education, Native American tribal governments that are federally recognized, public housing authorities, Indian housing authorities, Native American tribal organizations other than federally recognized tribal governments, not-for-profits having 501c3 status with the IRS other than institutions of higher education, nonprofits without 501c3 status with the IRS other than institutions of higher education, and private non-profit institutions of higher education. Next slide, please. Cost sharing or matching. You're not required to provide cost sharing or matching in your proposed budget. If you voluntarily include cost sharing in your application, you must include in your budget narrative a non-federal sources justification. During the merit review of an application, cost sharing will only be considered in the overall review of the adequacy of the total proposed budget, federal and non-federal share, to support the project proposed. Applications including voluntary cost sharing or matching that result in an award will include the cost sharing or matching commitment on the notice of award at the level proposed in the application. Any change in that commitment will require prior approval by the grants management officer. Next slide, please. Okay, the notice of funding opportunity announcement. So this notice of funding opportunity that you're looking at now provides, or it does provide, information and guidance related to applications. We implore you to read the entire funding announcement. Please follow the NOFO carefully and keep in mind, as it was stated earlier, the information provided in the NOFO takes precedence over any conflicting information in any other documents, including our presentation today. Next slide, please. So, the address to request application package. You can obtain an application package electronically by accessing grants.gov. And you can see here the URL here for www.grants.gov. And you can find this application package by searching the assistance listing number found on page 2 of the NOFO. And the assistance listing number for this particular NOFO is 93.137. So, please be sure to subscribe to the announcement in grants.gov so you receive notification of any updates to the NOFO or supporting documents. Next slide, please. Application submission. So OASH requires that all applications be submitted electronically via grants.gov unless an exception has been granted by the grants management officer. If you submit an application via any other electronic communication, it will not be accepted for review. Grants.gov is a website portal, and all funding opportunities and grant application packages are made available on grants.gov. An application will not be considered valid until all application components are entered in grants.gov and received by OASH Grants and Acquisitions Management, or GAM division, according to the deadline specified in the dates section of the NOFO. You can contact grants.gov with any questions or concerns regarding the application process. You can use this phone number that you see here listed on the screen. That's 1-800-518-4726. Next slide, please. Okay, application submission. So you want to submit your application as 3 different files. The first file should be the entire project narrative. The second file should be the entire budget narrative, including supporting documentation described in the budget narrative content section. File 3 should contain all documents in the appendices uploaded in the attachment section of your grants.gov application. Please note that required standard forms do not apply towards your page count limitation in the submission requirements as stated in the disqualification criteria. Next slide, please. Any files uploaded or attached to the grants.gov application must be of the following file formats. So you can use Microsoft Word, PowerPoint, Adobe PDF, or the image formats, that we are listing here. So you can use JPEG, GIF, TIFF, or BMP. Microsoft Excel files will not be accepted. HHS OASH strongly recommends that electronic applications be uploaded as Adobe PDF. If you convert to the PDF prior to submission, you can prevent any unintentional formatting that might occur with the submission of an editable document. You can also check the page count of your PDF and/or print the file to ensure that the document does not exceed the page limit. Next slide, please. Please be complete with your application and don't leave any blanks on forms unless the information is clearly not applicable. The individual submitting the application forms must have the legal authority to act on behalf of your organization. Next slide, please. To ensure successful submission of your application, you want to carefully follow the step-by-step instructions provided at the blue URL that you see here below. These instructions are kept up to date and also provide links to frequently asked questions or other troubleshooting information that you may need. Next slide, please. Application elements. All right, with regard to forms, you need the application for federal assistance, or the SF-424, the budget information for non-construction programs, SF-424A, assurances for non-construction programs, that's SF-424B, the disclosure of lobbying activities form, that's the SFLLL, and the project abstract summary. So your project narrative, you should submit all project narrative content as a single acceptable file. The budget narrative, submit all budget narrative content as a single acceptable file. And finally, for the appendices, submit all appendix content as a single acceptable file. Next slide, please. Okay, as for the project abstract summary, if you receive an award under this announcement, your project abstract summary will be published. So please don't include any proprietary or confidential information in your project abstract summary. Next slide, please. Your application format. Please be sure to follow project narrative formatting instructions in the NOFO. Your application will be disqualified if it does not conform to the format requirements. So you must double space the project narrative pages. You must use 12-point font. You should use an easily readable typeface such as Times New Roman or Arial. You may single space tables or use alternate fonts, but you must ensure that the tables are easy to read. For appendices and budget narrative, you should use the same formatting specified for the project narrative. Appendix documents such as resumes may use alternate formats common to such documents. Next slide, please. The UEI number and the System for Award Management, or SAM. Okay, so on April 4, 2022, the federal government completed its transition from using the 9-digit DUNS number as the official unique entity identifier to the 12-digit UEI SAM number. The UEI will be required for the submission of applications. You can find additional information about the transition for both existing and new SAM registrants at the blue URL that you see on the screen here. Next slide, please. Okay, so the System for Award Management. So your organization has to register online in the System for Award Management, or we call it SAM. Applicants are advised to begin the SAM registration process immediately. If you're selected for award, an active SAM registration may be required prior to receiving an award. You should make sure, that your SAM registration information is accurate, especially your organization's legal name and physical address, including your zip +4. Should you successfully complete and receive an award, this information as it appears in SAM must be included on a notice of award. So for instructions on updating this information, please see the blue URL that you see below. Next slide, please. New registrations in the SAM system. If you are registering a new entity in sam.gov, you need to create a login.gov account if you don't already have one. Please note that the complete process for registering a new entity involves submission of a notarized letter. Keep in mind that the minimum time frame to complete an initial SAM registration online is 30 minutes. The time frame for applicants' registration to become active is up to 10 days and may take longer depending upon volume. The average time frame for updates in SAM to appear in grants.gov is up to 72 hours. Next slide, please. Renewal registration in SAM. So SAM registration must be renewed each year. An active SAM registration may be required prior to receiving a new or continuation award. If you are renewing your registration, your old sam.gov username and password may not work anymore. You'll need to create a login.gov account if you don't already have one. Please review the information on sam.gov regarding the transition of existing registrations from DUNS to UEI. Next slide, please. We strongly recommend that applicants check for an active registration in SAM well before the application deadline. So if you're successful and you receive an award, you must maintain an active SAM registration with current information at all times during the active award. If you have not complied with the SAM registration requirements, HHS OASH may determine that you're not qualified to receive an award and may use that determination as a basis for making an award to another applicant. Now, should you successfully complete and receive an award, all first-tier subaward recipients must have a DUNS UEI number at the time that you, the recipient, make a subaward. Next slide, please. Funding restrictions. If you are successful and receive an award, by accepting the award, you agree that the award and any activities thereunder are subject to all provisions of 45 CFR Part 75, currently in effect or implemented during the period of the award, other department regulation and policies in effect at the time of the award, and applicable statutory provisions. Keep in mind that your costs for this project must be allowable, allocable, reasonable, and necessary direct expenses or indirect costs in accordance with regulations and current policy. Now, indirect costs may be included per 45 CFR 14, and applicants should indicate which method or rate is used for this particular application. Please keep in mind that pre-award costs are not allowed. And the current salary limitation is $203,700, and that was made effective on January 2022. Next slide, please. Budget narrative and forms. Please remember that they must be consistent with the requirements of the NOFO. Budgeted costs must reflect proposed activities. Budget line item descriptions and justification requirements are explained in the NOFO, so keep in mind to always look back to the NOFO. Suggested table formats are also in the NOFO, and then it has information for the plan of oversight of federal award funds. Keep in mind that forms, budget narrative, and detailed justifications do not count towards page limit. Next slide, please. Application disqualification criteria. So if your application does not meet the following requirements, it will be disqualified and receive no further consideration. So what does that mean? It means you have to submit your application electronically via grants.gov by the due date and time, unless an exemption was granted 2 business days prior to the deadline. Keep in mind that if you successfully submit multiple applications for the same project, we will only review the last application received by the deadline. HHS OASH GAM has to deem your application eligible. You have to complete the required forms in the application package. That's the SF424, the SF424A, SF424B, the SFLLL, and project abstract summary. Also keep in mind that your application must be submitted in the English language and must be in terms of US dollars. Next slide, please. Your project narrative must be double spaced on the equivalent of 8.5 by 11 page size with 1-inch margins on all sides and font size not less than 12 points. Your project narrative must not exceed 40 pages, and the total application, including project narrative, must not exceed 80 pages. The instruction pages built into the work plan template, which is optional, do not count toward the overall page limit. Next slide, please. If your application, continuing on the application disqualification criteria, if your application does not meet these requirements as well, it will be disqualified and receive no further application. So your federal funds requests, including indirect costs, should not exceed the maximum indicated in the award ceiling. For this particular project is $500,000. Your federal funds requests, including indirect costs, must not be below the minimum indicated in the award floor, which is $300,000. If you have included voluntary cost sharing or matching, you must include your budget plus including your budget narrative, a non-federal sources justification. Your application must meet any application responsiveness criteria under section E3, which is other application responsiveness criteria. Next slide, please. Applications that lack the required supporting documentation or submit additional appendix files will not be disqualified from competitive review. However, this may impact your application scoring under the evaluation criteria. So please be sure to follow submission instructions carefully. Next slide, please. Okay, so this is a brief application review criteria here. So your statement of need will be worth 10 points, the project plan, goals, objectives, and outcomes, 10 points, project plan, intervention, 10 points, your project plan, the work plan, 15 points, organizational capability, 15 points, evaluation plan, 20 points, dissemination plan, 10 points, sustainability approach, 5 points, and your budget, 5 points. Next slide, please. Application merit review. So eligible applications will be reviewed and assessed by a panel of independent reviewers with technical expertise in applicable fields according to the criteria listed in the NOFA. The merit review process is formal and confidential. Federal staff are available to answer questions and to ensure the process is consistent and fair, but do not participate in discussion and assessment of the application. Then applications are reviewed first by GAM staff for administrative and business compliance, and then by OMH program office staff for programmatic compliance. Next slide, please. Funding decisions. So the director of the Office of Minority Health will make final award selections to be recommended to the grants management officer for risk analysis. In making these decisions, the director of the Office of Minority Health will take into consideration the following additional factors: equitable geographic distribution of projects. Upon completion of risk analysis and the concurrence of the grants management officer, HHS OASH will then issue notices of award. No decision is final until a notice of award is issued, and all award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. Okay, the funding process. So we have to let you know that we're not obligated to make any federal award as a result of this announcement. You also need to know that only the grants management officer or the GMO can bind the federal government to the expenditure of funds. You also need to know that if you receive communications to negotiate an award or request additional, or you receive a request for additional clarifying information, this does not mean that you will receive an award. It only means that your application is still under consideration. And all awards, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. Okay, the funding process in terms of the review of risk posed by an applicant. Okay, so HHS OASH will evaluate each application in the fundable range for risk posed by the applicant before issuing an award in accordance with 45 CFR 75.205. OASH will use a risk-based approach and may consider any of the items such as the following as stated in your NOFA. We'll take a look at the applicant's financial stability. We'll take a look at the quality of management systems and the ability to meet the management standards as prescribed in 45 CFR Part 75. We'll take a look at an applicant's history of performance. We'll take a look at reports and findings from audits performed on an applicant. And we'll also take a look at the applicant's ability to effectively implement statutory, regulatory, or other requirements imposed on non-federal entities. Next slide, please. The plan for oversight of federal award funds. If your internal controls are available online, you may provide a link as a part of your plan in the budget narrative. We've also included supplementary material which contains questions applicants may find useful in considering their plan for oversight of federal funds. Next slide, please. Non-funded applications as a result of risk review. If we determine your organization does not meet either or both of the minimum qualification standards as described in 45 CFR 75.205A2, and we do not make an award to you as a result, we must report that determination to FAPIS if certain conditions apply. The information reported in FAPIS is available for other organizations to review when considering you for awards. Next slide, please. Okay, now we get to the notice of award. The notice of award notifies the successful applicant of its selection, the award amount, project and budget periods. It includes any conditions on the award, i.e. requirements that must be met as a condition of receiving the grant funds. And it also includes standard terms, reporting requirements, and contact information for OASH GAM and the program office. Next slide, please. Points of contact. Keep in mind that GAM, or the grants office, is the official point of contact for awardees throughout the award life cycle. All official communication related to the award is between GAM and the successful applicant. Unsuccessful applicants will be notified by the program office via letter. Next slide, please. So here is a summary and some tips. With regard to the project narrative description, please be clear, complete, and concise in the project description. Follow and address exactly what is requested in the NOFA. Do not make the reviewer search for the required information. Generally, the easier the application is to review, the better the rating or score. Keep in mind that reviewers are not allowed to do external research, follow embedded links, or anything like that. Clearly identify the sections of the application and indicate which component is being addressed. The project narrative must include all required information within the page limit. Do not use appendices to expand the page limit. Next slide, please. Project narrative description, we'll talk about it a little bit more. And as we stated earlier in our presentation, please make your goals and objectives SMART. That is specific, measurable, achievable, realistic, and time-framed if required in the NOFA. The activities that you present in your work plan should relate directly to the proposed goals and objectives. Your program work plan, evaluation plan, and other requested planning documents and the budget should provide a complete picture of how you will address the needs as well as address the purpose and expectations in the NOFA. Next slide, please. With regard to staffing, the staffing should be appropriate and reasonable for the goals, objectives, and activities of the proposed project. Please be complete in describing what staff will do, the expertise required, and the percent time they will be assigned to the project. Next slide, please. With regard to your budget should include adequate funds to carry out the proposed work plan, evaluation plan, and administrative responsibilities of the project. Your budget should be reasonable and relate directly to the goals and objectives of the project. Do not request more funds than are available as listed in the NOFA. This amount is inclusive of indirect costs. The operating budget should be complete and include federal and non-federal funds, projected program income, that means fees from third-party players and other contributing funds. Next slide, please. Overall, please include full names, first, middle, and last, for authorized officials, program investigator, project directors, and all essential or key personnel. Keep in mind that electronic submission is required. Please don't wait until the last minute to begin SAM registration or update your registration. Don't wait until the last minute to begin electronic submission. Problems could arise. Next slide, please. Okay, for NOFO inquiries, for the program questions that you may have, of course, the office that you're going to reach out to is the Office of Minority Health, and you'll reach out to Paul Rodriguez. His email is listed here as well as his telephone number. If you have administrative or financial questions, you can reach out to me. My email is listed below here as well as the telephone number that you can use to reach out to me. With regard to electronic submission requirements, you can reach out to grants.gov for application support. You can go to grants.gov and you can email the support team at support@grants.gov. The telephone number, in case you want to call on the phone, is 1-800-518-4726. Please don't contact the OASH program or grants office for grants.gov issues because we don't run that particular website. Next slide, please. So at this time, we're going to have our question and answer section, and I'd like to thank you for your time.
Thank you, Dwayne. So we will begin, as Dwayne has noted, our Q&A session. I'd like to remind you to continue to enter your questions into the chat box. If we are unable to answer your questions today, important note that all questions received during the webinar will be answered in the frequently asked questions document that will be posted to grants.gov. So we'll start first with our questions, let's see, under the general application category. So the first question, what is the deadline for submission of the competitive application in response to this funding opportunity?
I can take that question. So applications are due by July 15, 2022 by 6 p.m. Eastern time. Keep in mind that in order to receive consideration, you must submit your application electronically via grants.gov no later than this due date and time.
Great, thank you. And next, are cost sharing or matching costs required for this announcement, for this opportunity? Okay,
so I'm sorry, everyone, this is Dwayne again, and I just wanted to answer that question and say to you that you're not required to provide cost sharing or matching in your proposed budget, and that's described on page 14 of the NOFA.
Thank you. And William, if we could go to the slide just prior, there are many requests for the contact information. Thank you. Next question, is there a population size that applicants are expected to address through this funding opportunity? And that question is for Lieutenant Commander Braswell.
Thank you. As part of the statement of need, the applicant will define the community in which they propose the work. Applicants must use a data-driven approach that provides specific information on disparities experienced by the proposed priority populations and a justification for the proposed geographical area. And that information is outlined on pages 17 and 18 of the Notice of Funding Opportunity.
Okay, great. Next question, how many awards are expected to be made? And also, if you could explain the award floor, if you could give us that information, and the award ceiling per award.
Sure, thank you. We expect approximately 6 to 10 awards from this Notice of Funding Opportunity. The ceiling amount is $500,000 and the floor amount is $300,000 per budget period. And that information is also outlined on page 13 of the Notice of Funding Opportunity.
Okay, and follow up, a few questions for you, Lieutenant Commander Braswell. Next, if you could clarify if the estimated floor award of $300,000, if that represents the total award, or if that's $300,000 and that is direct costs only.
Sure, thank you. You can also find this information on page 13 of the Notice of Funding Opportunity. The estimated ceiling of $500,000 as well as the floor amount of $300,000 is the total cost that should include indirect costs, if applicable, as part of the proposed budget.
Okay, so just once again, the $300,000 that represents the direct and the indirect costs. Is that correct?
Yes, that is correct.
Okay. Next, the award amount that's listed for either the floor or the ceiling, does that represent an award for 1 year or 12 months, or does it represent the entire project period of 3 years?
Thank you. The award ceiling and floor amounts are listed per budget period. So that's a 12-month budget period.
Great. Again, as a reminder to today's attendees for the webinar, the slides today will be posted on grants.gov as a resource document, along with the recorded link to today's webinar will be posted on the OMH's YouTube channel. Next question. Lieutenant Commander Braswell, if you can tell us if an existing OMH awardee, that is, if an organization or an entity is funded under another OMH program, are they capable of applying for this funding opportunity?
Yes, any eligible applicants as outlined in the NOFO, past or current OMH awardees can apply for this notice of funding opportunity.
Thank you. Next question is for grants. If an entity is a for-profit organization and they partner with a nonprofit as the applicant, and the nonprofit receives the award, can a for-profit organization serve as that first line or as a subrecipient?
No. According to OMH statutory authority limits, recipients to public and nonprofit entities. Subrecipients must also abide by the statutory limitations that we have in place.
Thank you. Next question, programming. This is a program question. What policy assessment or analysis framework are applicants expected to use for this funding opportunity?
Thank you. As outlined in the notice of funding opportunity, the Office of Minority Health expects the recipients or the awardees to utilize the tools under development with the Coordinating Center, which is the National Network of Public Health Institutes. Interested applicants will find the tools that are under development by the National Network of Public Health Institutes on pages 63 and through 67 of the notice of funding opportunity.
Thank you. Can a collaborating organization, I should say this is a programming question, can a collaborating organization carry out specific tasks as it relates to the proposed project?
Yes, and this information is also outlined on page 29 of the notice of funding opportunity, where applicants should include a signed memorandum of agreement with all partners who will contribute substantially to this project.
Next question, what collaborations, and this again is a program question, what collaborations or partnerships are expected with this funding opportunity?
We'll certainly encourage interested applicants to review the notice of funding opportunity, specifically on page 9, where we outline expectations for recipients to create a new or strengthen existing multi-sector teams focused on addressing factors that may contribute to structural racism in public health.
Okay. Next question is focused on evaluation and performance management. The question is, what should baseline and outcome measures, or when should baseline and outcome measures be collected?
Each applicant should describe a feasible approach for collecting baseline, interim, and post-intervention process outcome and impact measures. And this information is outlined on page 39 of the NOFO.
Next question is also evaluation. Where can we locate the OMH's data reporting expectations that are required for this project? Do we need to collect or report on data at baseline, exit, and follow-up?
Yes, for grant recipients will select appropriate interventions to evaluate, which will show a measurable difference in selected populations, and certainly looking at collecting that information at baseline, interim, as well as post-intervention, and that information is outlined on pages 38 and 39 of the NOFO.
Next question, also evaluation. The NOFO speaks to outcomes that are phrased as policy and practice impacts. That is, for example, environmental health or mental health, preventative health services, or other health services. Is there an expectation that the projects also provide data that these policy and practice changes have made measurable differences in population metrics overall or within some tracked cohort?
Yes, for the grant recipients' policy interventions, recipients will select the appropriate policy interventions to evaluate, which will include showing a measurable difference in selected populations as described on pages 38 and 39 of the NOFO.
Great. Next, does OMH have a requirement for hiring an external evaluator for the project?
The NOFO does not require the applicant to hire an external evaluator.
Next question, evaluation also. Is a control group a requirement for the evaluation?
No, a control group is not required for this funding opportunity.
Okay. Next question again, if you would, remind us of the estimated award floor and the award ceiling. And if you would, if you could tell us that award, if that is for a 1-year period or if that is for the project period of 3 years.
Yes, so the ceiling award amount for this notice of funding opportunity is $500,000, and the floor amount for this notice of funding opportunity is $300,000 per budget period, which is in a 12-month increment.
Thank you. And again, I want to remind the attendees for today's webinar that questions that you've entered in the chat box or questions that are submitted to the points of contact that are noted on the NOFO inquiries, the questions will be posted as part of our frequently asked questions document with the responses to ensure fairness so that everyone has access to the information. That is both the questions and the responses. The webinar recording will be posted to OMH's YouTube channel. And at this time, we would like to thank our presenters, Lieutenant Commander Martin Braswell and Mr. Dwayne Barlow. Thank you all for joining the Office of Minority Health's Technical Assistance webinar. We wish you all the best of luck on your submissions and have a wonderful day. Thank you.